But these are Bob Daly's determinants, you know, for gait with limb loss. So with step width, step length, and then the closed chain, right? The toe load, knee flexion, pelvic rotation, and then trunk rotation. So we're just gonna have Kristen walk back and forth a couple times, a couple thousand times, and see. So you guys are kind of very nicely spread around. So for you guys on the end, I want you to see if you can see what we're doing with step width. For you guys on the side, let's check out step length. So normal width of walking base is supposed to be about 2 to 4 inches, right between the heels. So we're gonna try to visualize that. We're gonna say that we're gonna try to lay down a 12-inch roller between the heel and the toe, just as a minimum. And in case you guys are wondering, if that doesn't sound very scientific, you know, because that's not really even what step length is, it's heel to heel, right? The thing is, number one, we're doing visual or observational gait analysis, so we're not gonna get very technical. But number two, your step length depends on what? How tall you are. In some cases, whether you're male or female, those are at least two of the variables. So if you look at the medical literature, there's not one set step length that we all have. So this is, like I said, we're talking about a minimum just to give us a good idea and make sure it's symmetrical from left side to right side. And then we're gonna look at the toe load, knee flexion, pelvic rotation. One of the ways to try to figure out if the knee is flexing enough is to look at, we call it heel rise. In prosthetics, we call it heel rise. It's how much your heel rises before you actually go into swing. Technically, from a PT standpoint, that's initial swing, right? Because it's initial swing here, and then you get mid swing, and then terminal swing. So, but what you can tell is if her right heel comes up this high, then it would be really nice if her left heel came up that high. So that's, again, it's a visual cue you can try to use to see if we're getting enough. All right, so do you mind walking back and forth a couple times? Click in there for a second. Is that you in the socket? That's good. Couple more times. One more. I'll say one more about 10 more times. All right. So what do you guys think? How's she doing on step width?
When she's walking, kind of seems like the faster she goes, the more it seems to go that way. When I think she kind of starts thinking about it, having a bunch of people looking at her walking.
It adapts in what way now?
That's immediately.
Her prosthetic one does?
Yeah.
Anyone else see that? I'm not questioning you. I'm in this plane.
Yeah.
So, does her sound limb come to the middle, or does her prosthetic side come to the middle? Well, first the question is there 2 to 4 inches between her feet?
No. I feel like at times there was, and there were times one was doing something and another thing would do something. It was, I wouldn't say it was consistent each time.
Okay.
So,
Okay.
yeah.
All right.
I'm gonna move this guy.
Can we do, hey, Kristen, can we do one more? Down and back?
Looking at the street. So you guys pull around over here.
And it is completely different. If you guys are doing visual, any kind of observational gait analysis, you want to be perpendicular to the plane that you're watching all the time, or you're going to see different things. For sure. So is it a little adducted, the prosthetic side? Okay. Yeah, one more time. I told you I'd say that a lot. Okay. Good deal. All right. So you think the width of walking base is okay? And she's not bringing her sound limb too far underneath to her midline?
I don't think she's doing anything that would like have her fall or make her like not safe.
Okay. Okay. What about step length?
It looked pretty symmetrical.
Pretty symmetrical?
Well, we were saying that we saw like when she what is it called? Initiate her prosthetic leg, it's a little longer than
some of the steps it was a little bit longer. It is pretty symmetrical, I would agree, it's pretty close. I think there's the occasional step she takes that the prosthesis just goes out a little bit more than this outcome. Okay. What about her, the toe load and the heel rise? So is she keeping her toe down? And is she getting good knee flexion as she comes through?
The heel rise from my perspective.
Look good. You can see the bottom of both of the feet. From the back, you can look at the bottoms of the feet and see how much of the bottoms of the feet you can see. One of the other things that works on carpet sometimes is an auditory effect. So either where you can hear the footfalls, where it's like clunk, 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 clunk. It shouldn't sound like a heartbeat. Walking should sound like a metronome. Clunk, 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 clunk. Right? So sometimes if all else fails, I try to get patients to tune into the auditory part. And if you have carpet, you can actually put the adhesive hook on the heels, and then they walk and it goes, and you can hear them, and then they can hear that they're going, and they're doing a quick step, like that, and it kind of gives them some auditory feedback. So that looked pretty good to me too. I think we can probably get her looking a little bit better. We'll practice a couple of things, but I think you guys would probably agree with me in saying they would be all pretty minor, right? Like little tweaks, things to work on, because she does so well. So one of the things I want you guys to teach, I want to teach as far as assessment goes is, if you have somebody that's looking a little bit like that, and you're not sure, just like a postural assessment where you're going to put your hands or your thumbs on the ASIS and see if they're level, you can do that when somebody's walking. So you can put your hands on her ASIS, and then just see what's going on. Because what should happen at the ASIS is you should be going anterior, posterior about 5 degrees. So you can just gently, without resistance and not trying to get in her way, put your hands on and then see how that looks. This can be kind of hard to do. You want to back up just a little bit so we have a better run. And you guys let me know when I'm going to hit the wall. So I can just put my hands right here. And I can actually already see that my right hand, it's back a little bit. She just tends to hold that back. A lot of people do tend to retract that hip on the prosthetic side, right? So I'm going to get her going. I'm going to put my hands here, and I'm just going to walk with you. I'm not going to get in your way. Go ahead. And I'm going to see where my hands go. You can walk faster. I'll get out of the way. I promise. Right? You see what? It is. I'm not sure if it's you or me that's a problem. All right. Can you guys, I don't know if you guys can see that. Watch my right hand. All right, go ahead. I'll go the way. Okay. Did you see what was going on? Right? When it's supposed to be going this way? Right? So you can see that, and whether, like I like to, if I'm showing somebody, I like to put my whole hand on, because what you're going to see is it's going to go like this, right, on the hip, as it's rotating backwards and posterior. What we want is we want both to come into the hands alternately, but a lot of times that one disappears, okay? So what does that mean? It means that she's doing really, really well, except we could probably talk her into getting over her toe just a little bit more and bringing that pelvis forward. So the other thing that you can do is find the ASS. Now you know what's going on, right? So I find that hip bone over here, right? Have we done this before? Okay. Go ahead and walk a little. So if she's walking and it's going to disappear out of my hand, then I can just kind of go like this, right? So I was just going with her to see. And think, follow me. So let's walk this way, you and I together, but I'm not going to push you. Okay. Promise. The other thing doesn't work if I tell you ahead of time. Okay. So if we walk back, right, and she's on her right leg, it's the opposite side hip, right? So it's when her sound limb is on the ground that the pelvis isn't rotating. It's not actually a problem where she's on the prosthesis. She rotates just fine on her prosthetic side. So it's sort of counterintuitive to what you might think, that it's not rotating forward, but it's when she has her weight on her sound side leg. So if we do this again, and pull something to push you again, right? She might react to it differently, but when she's on her sound side leg, I give her a little bit of resistance, and she already recovered better, right? Because she knew I was going to do that. See, so everybody